Hi, and welcome to our first session in the NADTC Human Services Transportation course. My name is Eileen Miller, and I'll be the moderator for the course, and I'm excited to kick this off. But before we begin, I want to provide a little bit of background on why we're doing this course and what we hope you'll get out of it. So our course is focused on human services transportation, and we want to provide you, the participants, with a broad overview of a variety of the transportation approaches and explore a couple of ways in which human service agencies can work with the wider network of transportation providers to ensure that the needs of the community are met. We do have a wide range of participants who've registered for this course. We have folks that work in healthcare, social service agencies, we have mobility managers and travel trainers, we also have community planners and transportation planners, and public transit agency employees. So we want everyone in our course to get an overview of some of the different approaches that are working across the country through presentation examples, and then how you can apply some of these strategies in your own area to start building a network of transportation options that includes the value of human service agencies. And we also hope that you can use this course as a chance to share your experiences with others. What's working, what's not, questions you might have for other participants or speakers. And we encourage interaction, and you should all feel free to be able to post on the LinkedIn forum with your thoughts or questions. So before we begin today, I would just like to provide a definition of what we mean by human services transportation in this course. So we're talking about transportation services that are provided by or on behalf of a human service agency to supplement available transportation that meets the needs of a particular population, whether it be older adults, people with disabilities, children, veterans, etc. And the transportation services provide access to agency services and or meet the basic day-to-day mobility needs of these transportation disadvantaged populations. And we'll be posting this definition along with a few other terms that you might encounter in the presentations in a glossary that we'll be adding to as the course progresses, and there might be more terms that come up. So let me just quickly run down some of the different pieces of today's session. To kick off our first session, we're going to be opening up with a conversation with Virginia Dize, who's the co-director of the National Aging and Disability Transportation Center. We'll follow with a presentation from the Coastal Bend Center for Independent Living in Corpus Christi, Texas. And there will also be a link to written materials that were provided to us by Cindy Zwart from Sound Generations in Seattle, Washington. Last, there will be a link to a learning assignment that we suggest you complete prior to session 2 release, which we anticipate that release will be in just about 2 weeks' time, so right around January 30th. And then a third session will follow that just about 2 weeks after, so we hope that gives everybody enough time to both complete the course and the learning assignments by about March 1st. And do remember this is all self-paced, so feel free to work through it on your own time. So let's start a conversation first with Virginia Dize. So Virginia, thanks so much for being part of the discussion today. Human service transportation is part of a larger family of transportation options. Can you talk a little bit about the list of options that we see on the screen and why it's important for a human services agency to be involved in transportation?
Sure, Eileen, and thank you for the opportunity to participate at the beginning of this course. I think it's a really exciting prospect, and I'm very pleased that all of you folks have registered to join us. The family of transportation options is just that. It's a very diverse, individually specific group of transportation services. And what's really, I think, exciting about this entire list is it offers great opportunities for flexibility, for creativity, for matching services to individual needs. But of course, every community can't provide every one of these services, and every organization is not necessarily able to provide particular kinds of transportation. Certainly the basics are public transit and paratransit that accompanies it. And if you're lucky enough to live in a community that has good public transit, so much the better. But certainly when we're talking about older adults and people with disabilities, caregivers, veterans, children, there may be a need for other kinds of services to supplement transportation that's been designed with the general public in mind. And so you have this wide variety of services volunteer services, transportation with assistance, private pay options, as well as things like mobility management and travel counseling, neighborhood shuttles, voucher programs, travel training, one call, one click, and certainly the importance of planning and coordination. And human services transportation is certainly an important part of that picture. One might say that human services transportation encompasses a lot of these options, and that would certainly be true. I think the reason why we are lifting out human services transportation and saying it's really important to concentrate some time and effort and for all of us to learn together about human services transportation is it is so diverse. It is so hard to define. It is so hard to figure out where public transit begins and ends and where human services comes into that whole picture. And as far as the rider is concerned, it's really important that those ties and those connections between and among all these different options be fairly invisible, and that people are able to hop from one option to another depending on their circumstances and what they need. It's a complicated picture. And so it really is very important for human services agents specialize in serving older adults and people with disabilities to be actively engaged in transportation in their communities. We know, those of us who've worked in human services for many years, know that if we're going to support people to live as independently as possible in their homes and communities, that transportation is a service that undergirds all that. It enables people to stay connected to family and friends, but equally important, it enables them to get to school, to go to work, to access healthcare services, to go to other social services kinds of settings, to socialize with people, as well as do their business. That enables them to live a useful and daily and usual life. And it also helps bring people together. So these services are really critically important to support what those of us in the Aging Network call aging in place, and what people in the disability community put a lot of emphasis on, which is living independent, fully engaged lives.
Mm-hmm. So speaking of that diversity and flexibility and the differences that we might encounter in the variety of human services transportation programs across the country, can we talk a little bit about the scope of transportation? And I mentioned this in the definition that we provided with human services transportation, but can you help us explore that definition a little bit more, and how broadly really should we be thinking?
Well, I think we should be thinking about options, so different ways to provide rides and who needs those options. For example, a lot of people, and a lot more people than currently use it, can take advantage of public transit where it exists, but they may not be using it. And this is especially true for older adults or for other people who have just never ridden a city bus. And it could be that the services in your community are somewhat limited, but again, those services may still enable you to travel from your home to other points that are important to you, such as a grocery store, pharmacy, or the doctor's office. So it's important to explore using those options, but travel training is a critical service that can teach someone who's never ridden a bus how to ride it and how to be, more importantly, how to be comfortable on it. Mobility management is one of those terms that came from the transportation world, and many of us in human services have started calling it other things like travel counseling or mobility counseling. And what it means in a nutshell is that it's an effort to help people figure out, okay, what's available in their community, and then for this particular reason, like going to the doctor today, what's the best way, what's the most efficient way, what's the most cost-effective way that I can use to get me there safe and sound and on time. And then when I leave the doctor, if I'm going to have some kind of medical procedure that's going to leave me not feeling so well, maybe I was able to ride the bus to the doctor, but maybe I need to be in a car, in a taxi, or with a TNC, or with a volunteer driver to get me home. So transportation is very individually and circumstance-driven, and services like mobility management, mobility counseling, travel training, those kinds of services are really, they're not exactly transportation options, but they really undergird the whole gamut of services that may be available in the community.
And I think that's a great introduction. We'll be hearing a lot more about mobility management, especially in the next session and the sessions to follow. And many of these phrases that you see on the screen now will be included in the glossary that will provide a detailed definition for you. So thank you so much, Virginia. I think that's a great introduction to what we'll be hearing next and then throughout the rest of the coming weeks with our presenters.
My pleasure.
To finalize this piece of the introduction session, we want you to think about the following questions as you listen and as you read through the provided material. And we'll also post these on the LinkedIn forum. So how effective is your community in meeting the transportation needs of the population that you're concerned about? And what can you do to increase support in your community to better meet those transportation needs? And feel free to post your answers on the LinkedIn forum after you listen to the full session. So next up, you'll be listening to our first presentation from Coastal Bend Center for Independent Living. And thank you for joining us today. Hello, everyone. This is Eileen Miller welcoming you to our first session in the NADTC Human Services Transportation course. Today, we're going to be hearing from Judy Telge and Sabrina Avila from the Coastal Bend Center for Independent Living in Corpus Christi, Texas. They're going to be sharing some great information about their organization and their involvement in finding ways to fill gaps in their community's family of transportation services. Judy and Sabrina are two experts who have a lot to share with you. Judy is the founder of the nonprofit Coastal Bend Center for Independent Living, having served as the executive director from 1998 through 2012. Currently, she's the director of development and mobility services, the architect and builder of the innovative Mobility Options and Mobility Now project with public transit support. She serves on the advisory committee of the National Center for Mobility Management, which you may recognize as a sister FTA Technical Assistance Center. And Sabrina is the mobility coordinator for the Mobility Options project, and the third individual at the local level receiving on-the-job training in mobility management principles that meet national standards. Sabrina's background is in human services organizations case management, which includes the former AIDS Foundation and the MHMR Center, as well as Child Protective Services, provide the skills needed for multiple demands of consumer-directed, gap-filling transportation services. So, Judy and Sabrina?
Well, thank you so much, Eileen. We're happy to be here. And we will start off our presentation by looking at the slide that should be on the screen right now called Mobility Services. And that's my business card, Coastal Bend Center for Independent Living. And you'll see in the rust color, assisting individuals with disabilities to achieve their goals. We will get into that in a little bit more in an upcoming slide. So we're ready for next. We've been asked, and we're extremely happy to be able to do this, to provide some information about the role of human service organizations in developing solutions to gaps in transportation. So our presentation today is going to look at some questions that I think a lot of human service organizations face when they are trying to deal with their consumers, their clients on a day-to-day basis. Those questions are what? That means what do we have currently? what can we have, what should there be in the community, why, and that may apply in many different ways as well, like why are there barriers, why are there gaps, why the particular program that's developed, and then how. How do we address what our community's needs are given what's available, what's the political climate, as well as other aspects of climate. This is all part of the idea to help map transportation options throughout the country. Next, please. So let me first start with telling the audience a little about our organization, the Coastal Bend Center for Independent Living. We're based in Corpus Christi in the Coastal Bend region of South Texas. If you look on a map, we're below Houston, San Antonio, Austin, but above the Rio Grande Valley, right on the water in the bay. We were established as a Center for Independent Living, a CBCIL, in 2002 with a grant from the U.S. Department of Education, Rehabilitation Services Administration. That was the funding mechanism for several years for centers throughout the country. That has changed now because we are now found within the Administration on Community Living under the U.S. Department of Health and Human Services. We are one of several agencies now at that home, including with the Aging Communities Services. Now, what a center does, excuse me, which may be different or distinguishes us from other human service agencies and nonprofits, we provide core services to individuals with disabilities of all ages. These core services include information and referral. I think we all know what that means. Peer assistance, that's one-on-one or group, individuals with disabilities to individuals with disabilities. Independent living skills training, advocacy, both personal and systemic. And by the way, we're the only federal organization that we know of that can provide advocacy in the manner that we do. And the fifth core service, transition services. We are cross-disability, consumer-controlled, non-residential, independent, nonprofit organizations. One of the guides that one looks for as far as Centers for Independent Living is that term, consumer-controlled, and we will talk about that a little further relative to the project that we have. But do keep in mind that consumer control means the majority of people on our boards of directors are people with significant disabilities, and our staff is a majority of persons with disabilities as well. Our mission is to assist individuals with disabilities to achieve their goals. Pretty simple, pretty straightforward, and certainly in keeping with consumer control. Next slide, please. So now I'll talk just briefly about the CBCIL mobility services. As you see, two blocks here. We basically have two funding streams, or rather two emphases. The funding streams are a little different, but I'll talk about that. The 5310 funding, which is actually the enhanced mobility for seniors and individuals with disabilities, is our current funding for the Mobility Options Project. That basically is providing purchase of services and mobility management, two prongs to that particular project. Then something new that we've just begun this year, and this funding comes from TxDOT, it's not 5310, it's planning funding, for a planning and demonstration grant that we're calling Mobility Now, Liberty. This is real-time transportation in rural areas, and I'll give a little more detail later. Next, please. We've got to talk about the why. And the why for those of us who are involved with Centers for Independent Living, just as I believe other human service organizations would be, are what do people, our consumers, our clients, what do they come to us with on a daily basis? Well, we look at the fact that when they ask for assistance for certain things, it's because if you drill down far enough, you'll find out there are barriers to living independently. There are barriers for individuals with disabilities of all ages to access community living as others do. That should sound familiar for folks who work within the aging services community. And there are very definitely parallels between the two populations. The access to community living, again, if you drill down a little more, you'll look at, well, what in particular is there difficulty as far as access? Well, I picked the 5 top concerns that we get on a daily basis from people with disabilities, with all types of disabilities. Education is one, not necessarily the greatest impact. Employment is very definitely another one. Healthcare, and that means not healthcare as far as being in an institution, but healthcare overall. Housing, a very big aspect, a very important aspect of living in the community. Several barriers in that particular realm, and of course transportation. Many barriers, not just from having an inaccessible path of travel when individuals with physical disabilities want to utilize their local buses but can't for that reason, but there could be barriers such as lack of hours that make, or days of service that make transportation accessible to every need. Next. I'd like to share with you about the Mobility Options Project, some of the things that are salient points. Number one, first and foremost, the Mobility Options Project is a consumer-directed model. It was actually based on a consumer-controlled voucher program put together by the Association of Programs of Rural Independent Living Centers. And this was several years ago when this demonstration was put together. And what it did was tested over a 5-year period the provision of vouchers to individuals with disabilities to be able to use their vouchers in any way they needed to get to whatever it was they needed to get to. So based in consumer direction is, of course, the ultimate and the basis of our Mobility Options Project, because I took that particular model and then adjusted it to this area in rural South Texas. And because it was JARC funded, Job Access Reverse Commute, we had to make some adjustments because it was specifically for employment-related travel. So in a consumer-directed model, just to further define that, consumer-directed means the individual consumer is the one who's in charge, in control, if you will. It's not other people. It's not parents. It's not caregivers. It's not even transportation providers. One of the other important elements of what we're providing is a feature of cost sharing. That cost sharing is something that is not just for the consumer to pay a share of the cost, but for additional funding sources. It is, if you want to look at it, kind of a model where everybody chips in some way. The providers that we utilize are amenable to negotiating prices. As a matter of fact, that's one of the criteria that we use to be able to identify transportation options that we'll utilize. The consumer is there is no charge per se to them other than what they can afford to pay. If their ability to pay is absolutely zero, then there is no charge to that person because there is subsidy. One of our cost sharing examples is with our local VR agency, and it's an awesome way to actually demonstrate coordination between different entities. Every person that they refer to us for a job-related trip, they also send money with that. So what we are doing is we're splitting the cost of every trip. And what that does with that 50-50 split, each one of our entities, ours and theirs, are able to stretch their public dollars further and therefore serve more people. Purchase of services is a method of being able to purchase services, transportation trips, if you will, from mostly private providers. And these providers sign contracts or memorandums. I think what we call ours is a purchase of service agreement. And what they will do is be the ones that actually fill the gaps. And it might be after 10 at night when a trip is needed after the public transit has shut down for the day. It might be being able to fill one way of the trip. Actually, Sabrina has a couple of examples relative to that. So our purchase of services is with primarily private providers, including over-the-road vehicles like Greyhound when trips need to be put together for over distance. And of course, the important thing that we have that holds the glue together of everything is mobility management. That, as we know, is a customer-focused approach to identifying transportation solutions, both on an individual and systemic level. And what it does is it leverages all transportation resources that are available in the community. Next, please. So I'd like us to now hear from Sabrina, and she is on the ground with our Mobility Options Project. So she'll go through the information relative to what we do with this program.
Hi, thank you, Judy. My role as a mobility coordinator is to provide the day-to-day hands-on consumer activity and coordination. The first step that takes place typically is the referral. We do receive referrals from other agencies, sometimes family members, other transportation providers, and also from the individual directly. One of the first steps also is to first look at what the individual's needs are, whether they need accessible transportation, look at what area they live in, what area they need to go to. Sometimes a call may come in and it is what we call information and referral, because I identify what resources may or may not be available to the individual, depending on the area in which they live, and oftentimes people are just not aware that there is in fact transportation available to them either through the public transportation provider in their area. So at that point, what I would do is, of course, refer them to the appropriate provider. The next step is to do what we call the Individual Mobility Assessment and Plan, or we call IMAP for short. We identify the available resources in the area, like I said, whether they live in an urban area or a rural area, and we look at whether the local transit provider is able to meet their transportation needs, such as days and times and trips needed outside the service provision area of that particular transportation provider. We also look at their transportation goals and what their previous transportation experiences are like and what may or may not be working for them. So once the individual mobility assessment and plan is completed, the individual is able to share with me information as far as what their trip needs are, where they need to go, and provides me with all of that information, and I actually am the one that schedules their trips. I'll identify the appropriate transportation provider, make sure that if they need accessible transportation, that the provider in fact does provide transportation that meets their needs. And another tool that we use is the trip quote and confirmation. That means that is the individual's information that includes the origination address, the destination address to where they need to go, the days and times, and then that's sent over to the appropriate transportation provider, who then first will give me a quote for that trip, and then also confirms with me whether or not they're able to, in fact, provide that trip for that individual, for that particular day and time. So at that point, what I do is, once I do have the trip confirmed, I simply contact the individual and let them know, your requested trip for, for this appointment on this day and time, has been confirmed, and it's as simple as that. They basically can pick up the phone after their initial assessment and plan has been completed and tell me, I need assistance with the trip, for this day and this time. We request that they tell us at least 24 to 48 hours in advance, but they're also able to call us, even a month ahead of time if they have the information to schedule their trips. The program also incorporates a customer satisfaction survey, which we feel is really important. Once somebody is in our program, we mail those out, and we use that to help us gauge, the service that we're providing and how we're doing, and is also, very important when you're providing a consumer-directed service. And as the mobility coordinator, I also am the one responsible for inputting all the data and reporting to our funding sources, and also just the information related to each of our consumers. Next. I'd like to share some information, two stories about two particular riders that have utilized our program for their transportation needs. The first of which is Megan. Megan was referred to our program by her counselor with the Texas Workforce Solutions Vocational Rehabilitation Services. She needed assistance with transportation for work. Megan was hired to work at the bakery department at the local Walmart, and was able to use the fixed route bus to get to work during the week. However, she needed assistance with transportation for her return trip home at night due to the fixed route stopping service prior to the time she got off from work. In addition, the fixed route was unable to accommodate her work schedule on Sundays because of the later start and earlier end times that were offered during Sunday bus routes. Megan was able to utilize M.O.P for several months until she was able to transfer to another Walmart location, which was closer to her residence, and then she was at that point able to use the fixed route bus for both trips to and from work. The next individual, Raul, he was referred to our program by a social worker with Christus Spawn Hospital. Raul lived in a rural area and received dialysis treatment 3 days a week in an urban area that's located approximately 45 minutes away from where he lives. Previously, he was able to drive himself to dialysis independently, but not only did the drive become too difficult for him following his treatment due to, fatigue, his car also broke down, and he was not able to afford, the cost of the repairs. The public rural transportation provider in his area was not able to provide the trips he needed into Corpus 3 times a week. They were also not able to ensure his arrival to dialysis by his appointment start time. In addition, which I think is also very important to look at, is that sometimes, which was in this case, the provider charge is not affordable for the individual. In this particular case, the provider, he lived in Kingsville. The trip charge for Kingsville to Corpus round trip was $20. So you're looking at basically $60 a week for the cost of his transportation if he was in fact able to utilize the rural public transportation provider in his area. Next.
Okay, this is Judy again, and thanks Sabrina. That probably gave a little bit of an idea, better idea of on-the-ground activity with our project. I'm going to be getting into a couple of last pieces relative to collaboration. And I want to note that with this slide, we actually have a photograph of real people. The Mobility Options Project partners with our local regional transportation authority, primarily through our mobility coordinators. Sabrina is not pictured here, but a previous mobility coordinator that we had is. And the 2 mobility coordinators are actually visiting with 2 consumers as they learn to ride the fixed route buses in Corpus Christi. Marshall is the guy that's leaning on a cane, only because he's talking to these soft-spoken, lovely ladies who are using wheelchairs, both for different reasons. Marshall is a person who is blind. And Lori, the mobility coordinator with our program, is a person who is hard of hearing. So what you see represented here is a cross-disability group of folks who are out and about learning how to use the fixed route like everybody else in the community. And this kind of partnership is really, really helpful to making sure that people's needs are met. Next. And before I get into some of the collaborating other partners, I wanted to mention that one of our new projects that is just getting underway now is Mobility Now Liberty. This is a brand new planning and demonstration project. We're starting it out just the way we started out our Mobility Options Project back in 2011. We have a business partner, Liberty, who is out of Nebraska, and what we're doing is we have sought and secured funding from TxDOT to test their Liberty's new app for on-demand real-time transportation. And if I say Uber-like, I think that's something that people understand in rural areas. Why is this significant? Because anything like Uber on-demand real-time must have a high density to be able to truly operate well. Well, we're going to try it in the rural areas where the density is much less. And this app is something that has been developed specifically for that. So it'll be interesting to see what our 2-year planning and demonstration will uncover. It can also do pre-scheduled trips for medical appointments, which is something that's absolutely helpful, necessary for many reasons, for many stakeholders involved. It will complement public transportation. We are very hopeful that public transit will refer to us when they cannot do their, meet the needs of the individuals needing the trips on real time. And it basically does one more step further to fill the gaps beyond service days and hours. And it'll be a wonderful addition, we feel, to having a number of transportation options in our community, in our area. Next, please. So collaborating partners, can't do it alone. And I can't emphasize enough how helpful it is to be engaged in collaboratives and partnerships, whether they're existing or whether, like we did, we helped initiate many of them. For example, the very first one, I'll just talk about a couple of these that are really outstanding. The Accessible Community Transportation Initiative that was in effect several years ago was something that we sought from CBCIL's Project Action with the RTA. This was CBCIL and the RTA going after the ACTI, that initiative that brought people together in a community to actually plan for accessible transportation. Well, we were fortunate to be one of the selected communities in the United States that was able to do this. And that really was so helpful to us getting started in meeting the needs of folks that were facing gaps and barriers in transportation. Aging Disability Resource Center of the Coastal Bend, we are a key partner in that group. Aging and Disability Resource Directory, key in that group, going back several years to make sure that all the resources for folks who are aging, folks with disabilities of all ages, are able to access any and all resources that they may need in the Coastal Bend. Coastal Bend Health Finder collaboration, that is a wonderful cross-section of all the health-related agencies and organizations in this area. On the National Center for Mobility Management, I'm sure many on the call have heard of, and we're involved in our regional transportation coordination and planning activities. We were engaged back when that got started. And of course, partners also include our funding supports. That's TxDOT, that's RTA, now the Administration on Community Living, and of course our local vocational rehabilitation agency, in which we are a vendor so that we can do this cross-sharing activity. So we've got partners very much a part of the how. We've got under the why section of this presentation is to meet consumer needs. And I can't stress enough that to get started in providing services, you don't have to own the asset to provide the service. And that's something that we just need to understand when it comes to transportation. It does go beyond the current and traditional paradigm of public transportation, but you don't need a fleet, you don't need a van. There's always plenty of transportation vehicles that may not be fully utilized that would be anxious to talk to agencies, organizations about providing transportation during gap times. So it takes some creativity in addition to the partnerships, but it also takes being grounded in who your clients and your consumers are to be able to meet their needs. Next. So here we are, finally at the end. It's myself as project director and Sabrina as mobility coordinator with the Coastal Bend Center for Independent Living. And I got to tell you folks, it does take a team on the inside as well as the outside. I'm the one who gets to deal with the politics, the public policy, the funding, all those things, even systemic advocacy. But if we didn't have Sabrina as the mobility coordinator on the inside, we wouldn't get the trips arranged, we wouldn't make sure that we're meeting the needs of the people who come to us to assist in accessing transportation, but more importantly, in accessing lives in the community. Thanks so much for the opportunity.
Thank you.
Great. This is Eileen again. Thank you so much to Judy and Sabrina for sharing that information with us today. I know I learned a lot, and I think our audience will learn a lot. And you definitely introduced some concepts that we'll be addressing a little bit later on in future sessions. So to the audience, definitely stay tuned for that. So thank you so much to both of you, and we appreciate your participation.
Well, thank you for the opportunity. This is great. So